everyone, I'm Dr. Gardezy with QuickMD, and I'm going to be talking to you guys about a question I get with a lot of patients is, can I take semaglutide if I have diabetes or other medical conditions? Now, semaglutide has a strong effect on your appetites, and it is what's called a GLP-1 agonist. And the medication is actually used for diabetes before it was approved for weight loss. So yes, you can take it if you have diabetes, but it really depends. Every individual who uses insulin with their treatment of diabetes should not be taking semaglutide without first being monitored with its use. I see that this medication can be used with diabetes, but we have to be able to monitor you if you're on insulin. If you're having type 2 diabetes that is not insulin dependent, then you may be able to use semaglutide and it may actually help your diabetes. I see this as adjunct treatments with a lot of patients. They're usually on metformin. They could be on glipizide or glyburide, those other medications that help with diabetes. But I see semaglutide added to it and it helps decrease your HbA1c and leads to just overall better outcomes when you have diabetes. Now, the other part to this question is other medical conditions. That includes pancreatitis. It's one of the conditions that semaglutide can precipitate or cause. And individuals who have a history of pancreatitis can result in having it if they take semaglutide. That's why we don't prescribe to patients who have that condition. Depression, anxiety, those are things that we do discuss during our appointments. That semaglutide can cause an increase in suicidal thinking if you're using it with your depression medications, or if you have a history of depression. I would just discontinue the medication if you have increase in suicidal thoughts or development of suicidal thoughts, especially if you have a history of depression. You would have to discontinue it entirely. And what I would suggest is, if you're concerned about other medical conditions, that you talk to your doctor during your appointment about if the medication may interfere with your other treatments or other medications. Just please speak with your doctor about all that. And I'm always happy to spend as much time as I need with any patients, as do all the other QuickMD doctors who prescribe semaglutide.